I hope you enjoyed the virtual workshops. There was really great engagement in the Slack channels. Our next speaker is Professor Maya Lakhani. Maya Lakhani is a practicing GP in Leicestershire and chair of the Faculty of Medical Leadership and Management. He previously served as president and chairman of the Royal College of General Practitioners. Professor Lakhani, thank you so much for your time. Over to you.
Hello, my name is Maya Lakhani and I'm a general practitioner in Leicestershire. I've been the chairman and president of the Royal College of GPs. My current role is chair of the Faculty of Medical Leadership and Management and also chair one of the CCGs in Leicestershire. I'm a working GP and I also serve on the senior clinicians service of the National COVID Response of NHS 111. I'm very pleased to be able to address this important conference today. I want to thank you for the work that you're doing. I know you're working in very difficult circumstances, but delivering high quality care, particularly during the COVID pandemic. So let me thank Dr. Heba Khan and her colleagues for inviting me to speak at this national conference for the Medics Academy FDoc event. You are the future, and for this reason, I'm very interested to share my presentation with you, which is about how do we get a positive, optimistic vision of medicine. I love my work. I look forward to going into work and doing shifts. And I believe there has to be a better way. And I think doctors like you will have a key role in shaping the future. And now is the big moment with the COVID pandemic, a big moment for medical leadership to shape the future. And I want to share with you my thoughts about the future of medicine and to describe some of the new frontiers which I'm very excited about. Whatever your stage in medicine, I know you will be concerned. Perhaps this famous painting by Edvard Munch, The Scream, exemplifies what you might be feeling, a feeling of helplessness, of being scared, of a massive amount of change going on. But actually, I want to argue in this presentation that this is a moment of opportunity for a brilliant future in which I see a great role and contribution by junior doctors, which will make medicine the profession that we want it to be. So in my talk, I want to make the case for better models of care. I want to describe a concept and a vision of optimistic medicine. My argument is that there's too much negativity, but we can get to an optimistic place, and I need your help in that by reimagining healthcare. And COVID-19, although it's posed many, many challenges, and sadly we've lost many of our colleagues and patients in the pandemic, it offers us an opportunity because everything is changed. It's utterly changed. The key will be leadership from doctors like you. And I'll present you with a 3-point plan, which at this stage in your career, I hope will support you and guide you through a very challenging career ahead in medicine, but one that I think will be very fruitful. I always like to start with talking about the good things. You know, we are in the age of progress. I graduated as a doctor in 1983. Not so long ago. I feel I'm still learning. I enjoy my work. I'm a working doctor. I also take part in the COVID response service. It's a great time to be a doctor. It may not feel like it, but just look at what we can do for patients. We have epoch-making treatments, biological agents. In mental health, I've seen compelling examples of individuals who flourish through accurate diagnosis and treatment. When I graduated, most people with cancer died very early. Now, most cancer can be cured if detected early. I remember being a house officer in surgery, helping the surgeon do highly selective vagotomies for peptic ulcers. Now that is an operation no longer performed, as peptic ulcers are treated by antibiotics. I remember admitting people with heart attacks for bed rest. Now we encourage early activity. Look, we are in an age of progress. We have standardized and structured medicine. We have teams. We have diagnostics. We have computer systems. We have empowered patients, and we have more support. So what's not to like about modern medicine? But I'm sure most of you will say it doesn't feel a comfortable or happy place at the moment. And we're right to ask questions, but this is a paper that we wrote recently on optimistic medicine, and which sets out a vision around how we can capture the good things and tackle the challenges. The challenges are definitely there. Let me tell you about Mr. Patel, who is a hypothetical patient in Leicester, a type 2 diabetic, who unfortunately ended up having an amputation through gangrene. Nobody can be happy with this level of care in a country like Great Britain. This is an entirely avoidable scenario. Why is it important? Because he is a patient who didn't know what to do. He didn't understand his condition. He found the system very difficult to navigate. It was fragmented. There were barriers to access. There were language problems. He was from a BAME community. He had good technical care, but it wasn't joined up. No one can be happy with the quality here, the efficiency of care, or the well-being. And I'm very sad that this is happening. Unfortunately, there are many, many patients like Mr. Patel as we speak now in the UK. As doctors, we have to say this is unacceptable. We have to call this out. Quality and excellence is everything. This is why we became doctors. And I want your help to change this, not to tolerate poor standards, not to walk on by, but to change the system so we can promote excellence. And the profession itself wants change. We want more autonomy. So these are the drivers of change. We want flexible working. The well-being of doctors has never been important than now. I know the damaging effects of burnout, having helped many, many doctors, having suffered stress in my career a lot of times. Stress is a normal part of being a doctor. It is a challenging career. These are choices we've made. But when it gets too much, it affects your performance. I want to do more for my patients, but I'm sometimes frustrated that I can't because there are barriers in the way. And the culture of overregulation, complaints, I think too much defensive medicine. Why do doctors make mistakes? Often because they're hungry, they're angry, they're late, and they're tired. When that happens, you must halt. So taking care of yourself in optimistic medicine is a really important concept, because happy doctors will make for happy patients. And I want to speak to you at this stage in your career, in the foundation stage, because good habits start now. Because you'll need that to deal with the demands of modern medicine, the relentless rise in demand, too much medicine, overdiagnosis and investigation. One of the things I've particularly noticed over the COVID is the green agenda. We hardly make any car journeys now. All our meetings are virtual. The air is much cleaner. Isn't that brilliant? As doctors, we have a key role in the green agenda. So I want us together as a community of doctors to embrace the new frontiers in medicine. This is how we reimagine a better future. And there are 5 things in this. So one is digital, digital, digital. Digital innovation for access, for diagnostics, for risk assessment, to make early diagnosis. Genomic medicine. We know that new genes are being discovered as we speak. We can personalize medication and cancer treatments. The future will be about personalization of care. The third frontier, which is people-powered care. So no longer examples of Mr. Patel who are passive recipients of care, but active patients. You know the saying, the patient will see you, doctor. The doctor will see you, now patient. We have to have a role reversal. So there is a genuine partnership, and patients engage and take responsibility for their care. Fourthly, a strong and equitable healthcare system based on family medicine and the principles of universal healthcare, which I think is a global ambition that we should all support. And finally, no man is an island, no doctor is an island. Remember, whatever your role or position, you're working in a system of care, what I call team of teams. The future will be about a system of care. So to get a good outcome, you need an empowered, activated patients. You need good housing, you need good employment, good education. You need a good environment. You need good primary care access if there is a medical problem. You need that primary care system to be connected with community and hospitals and authorities. So it's all joined up. It doesn't matter who your employer is as a professional, but the care is delivered seamlessly. You might think, well, this is so unrealistic, it's not going to happen. Actually, somewhere in this country and in the world, this is happening now. There are examples of this, the new frontiers, which enable us to give great care. So this is just to show the importance of genomics. So this is work presented by a local pediatrician in Leicestershire, where I work, showing that, 49 new disorders have been discovered through genomic analysis, 4,500 diagnoses made, 33,000 families studied in pediatrics, 125 research papers. This is world-class research that's changing medicine. And imagine the power of this, where we integrate genotypes, phenotypes, environmental data, air pollution quality, lifestyle data, the food people buy. And so you have this picture of what's happening inside me, how do I feel, what's my situation at home, work and play, and where do I live. Imagine how we can understand the determinants of health. And this is a very powerful piece of work from a charity called the Royal Free Charity called Beyond Health. Absolutely brilliant piece of work, which imagines how we can pull all these things together. So in the future, and I don't think this is anything to worry about, in the consultation, you'll have the doctor, the patient, and Alexa with her friend Watson in the virtual consulting room. And anybody who thinks this will make medicine more impersonal, I believe they are incorrect, although I do understand that concern. I would urge them to read this book called Deep Medicine by Eric Topol. He argues that the use of artificial intelligence and digital can make healthcare more compassionate and human, because all the heavy lifting is done for the doctors. Look at your consultations or patient interactions. You'll spend a lot of time looking for reports, looking for results, filling in forms, trying to get a file, getting something across to the lab. In general practice, we know if you don't have all the information, it increases the length of the consultation. But imagine before a patient came in, artificial intelligence has analyzed the patient's data in the way I've described earlier, and is putting predictive diagnosis in front of you, telling you the possibilities. So it leaves you to spend 15 minutes with the patient, which is our holy grail, the standard we aspire to for consultation general practice. If all the hard work is done for you and automated, then what's not to like about that? And then to go on to the other frontiers about the system. So I've talked about the doctor being part of a practice, being part of an organization, being part of a healthcare system. So the question is no longer, Don Berwick said this, what do I do, but what am I part of? So this is a team of teams. And I hope that many of you will be interested in careers in general practice. Although, of course, we need doctors in all categories, and you must follow a career that's your passion. But a lot of people ask me this question. General practice is going towards a specialist status with the GMC, acting as a consultant to a wider multidisciplinary team, working as part of a network of practices, and being a key part of a system of care. I know you're concerned about workload and the business side sometimes, and burnout, but actually the future of general practice, which is in my next slide, is we are changing. Look at the amazing premises that we work for. These are actual premises somewhere in Great Britain. We're working at scale. We've got new roles, flexible grades, career progression, a chance to fulfill your dream of being a doctor you want to be. So my second part of my discussion is the COVID implication. And just briefly to say that I think COVID has shown the medical profession in its best light. There is no doubt about that in my mind. Medical leaders have transformed the care of people with COVID-19. To the best of my knowledge, nobody who needed intensive care was denied that in England. Hospitals mobilized very, very quickly. New pathways were designed. And this was remarkable collaboration and interaction. I've been on local COVID committees and pathway design groups. We worked with consultants, with social services, with community leaders, faith leaders. You know, what people are telling me, can it be like this all the time? How we work with together as a system and not silos. So people are talking about the new normal. And we've actually collected information on what is it that people want to continue doing and what is it they don't want to return to. Nobody wants to return to 50, 70 patients a day, 14-hour days. As you leave for home at 8 or 9 o'clock in the evening, 50 results pop into your pathology inbox. That is not sustainable. That affects the doctor's well-being and is not good for patients. So we have to use this opportunity to reset demand and to find new ways of working whilst retaining what we think is important. So who wants to go back to the old way? Is the old way sustainable? I would argue not. But the new normal is very attractive, and I'll describe what the new normal is. And I want your help in shaping that and in implementing that. But you know, there's a choice to be made. It's all about choices. Medical leadership is about choices to improve the healthcare system for our patients. And we have to choose. And I hope we can choose a stronger, better way, what I call optimistic medicine. So some of the things we noticed in COVID was the use of telemedicine or virtual care. A model of triage where patients are assessed for their need and then matched to the right care at the right time with the right healthcare professional. I'm very proud of how we supported vulnerable patients, broadly defined. So people who at the end of life, people with long-term conditions, people who are shielding, people who are having chemotherapy. We used a lot of systematic care planning and data sharing to give people the support they need through volunteers. One area where I think everyone will agree we didn't get it right collectively is support for care homes. And obviously that will be studied and examined. I think the learning from that is that vulnerable patients need enhanced support and enhanced care. And that's called segmentation of population. So population health management is going to be the future. And finally, a couple of things that I noticed, that people were enthused again in medicine, came out of retirement, people worked in hospitals and GPs, medical students worked in a different role. There was so much collaboration. People were empowered. You know, this freedom to practice medicine. appraisal, CQC inspections, all of that was suspended. And people's clinical professionalism was respected. Red tape was released. They were so enabling, So governance is important. Governance is needed to keep us safe, but it's enabling governance rather than to stop us doing things. Take, for example, the research trials, the principal trial. So much research has been done in such a short space of time, led by doctors. Why can't we make this the case all the time? This is my promotion and my mission for optimistic medicine, where doctors leading change for their patients. So the new normal is a digital front door of empowered clinicians, of patients who know what to do when they're sick, patients who will do self-care. We know that 26% of GP appointments are not necessary for the GP to see. Imagine if we had 25% spare capacity in primary care. We need to change the culture, population health, particularly for BAME communities and other disadvantaged peoples, and specialized care for vulnerable patients. No more silos, like GPs, district nurses, consultants, working together in a team of teams. So this is the emerging new normal. So just coming to my conclusion now, I want to leave you with 3 things. Firstly, I want to emphasize the importance of the doctor-patient relationship. I believe we can maintain that and make it stronger despite new ways of working. And I was struck by this painting, which was published in 1891. It's called The Doctor. And it captured the imagination of the people of Great Britain. It toured Britain, actually. And it shows the doctor looking at a sick child, a worried parent in the background. The child is looking very pale. I believe the child is floppy. The arm is rolled out. The doctor is observing intensely. Possibly the child has sepsis, as we would know it now, perhaps from meningitis. The child seems difficult to rouse. But you can see how the parent is observing this scene and the doctor with his hand on his chin looking at the child. And this is the epitome of what's called the human touch. It emphasizes the relationship between the physician and the patient. My question is, in the modern world of digital care, of fragmentation, of, anytime, anywhere, any access, any doctor, are we losing this human touch? I hope we don't, because I think we need to maintain this. And this painting was so powerful, you'll be interested to know that when it was exhibited around the country, one person, on seeing the intensity of the painting, died on the spot, because it was so powerful. So this is me doing one of my COVID response shifts, which is a remote assessment involving video, prescribing, telephone. So how do you reconcile the human touch with remote working and digital front door? So I think that in many ways we can do that. We're already doing that. Thousands of doctors are learning to connect. It's not a binary choice between digital and face-to-face. It's a blended approach. And I think we need to do more work on this, but I believe that you can make the human touch and compassionate care possible with all these modalities, as Eric Topol has identified, because it helps us to do what we're best at, which is clinical decision-making and treatment. So my take-home message is, leadership from doctors will make the biggest difference. This is a time of opportunity. I've pointed out that the legacy NHS had a lot of problems. Doctors are leaving. 40% of junior doctors don't enter specialist training. People were retiring. It wasn't a great place to see the future. The case for change is very strong. I've given you the example of Mr. Patel, and I've shown how technology, genomics, the empowered patient, strong primary care, and a connected system of care, a team of teams, can make a big difference. Now we need to make this happen. And what needs to enable this is leadership. We can reset the relationship between the medical profession, the NHS, and the state. So we no longer, if you like, construction workers where we build things that somebody else has designed, but we are the architects. And in this way, we can get a resurgent medical profession. And I think it's very important that I share that message with you as somebody who's on the threshold of, I hope, great careers in medicine. I've had a blast in my career. I wouldn't change it for anything. That's why I love working. But one thing is, you have to have the right mindset and grow your mindset. Invest in development, in coaching, in mentoring, in insights. Here's a question for you. After today, go home and think, how have you changed during COVID-19? How has your leadership changed in COVID-19? Look in the mirror and look both ways, because this is a great opportunity for you to show personal growth and a mindset development. Because we have to choose, because what's the current state like for patients? The chaos of modern medicine, the multimorbidity, the over-investigation. No one can be happy with the level of care because of iatrogenic disease. So as doctors, we can shape and influence the future. So here are some things I'd like you to do. Connect with people around you during COVID and after. Obviously not face-to-face or physically, but phone them, do FaceTime. Be visible. Doctors need to be visible. You've got to show confidence and establish stability. Communicate. And then things we do for our well-being, be active, keep learning. And don't just read about your core interest areas. Look at things that are perhaps outside that and something that's perhaps nothing to do with medicine. Give and support others and be mindful. So Nelson Mandela was once asked what kept you going during your 25 years on Robben Island in prison. And I visited that island like many people, and I've been in the cell where he was at. And this poem actually helped him greatly, where he said, I am the master of my fate, and I'm the captain of my soul. And what he meant by that was that we have more power than we think. We do have so we can exercise that control by imagining the best doctor that we can be. Standards are very, very important. You have to develop. Competence is key. Imagine the best care that you can help deliver for patients in the best healthcare systems. And how can you do it? A lot of people say to me, well, this is fine. We find your argument compelling, but how can I, as a junior doctor or as a foundation doctor, do this? Well, this is how you can do it. And if all of us do this, together we can make a big change. So this is my last slide and my 3-point plan, which is be the best doctor you can be. Be on the side of patients. You'll never go wrong. Act in the patient's best interest and needs. Notice I say needs, not wants. Okay? Be on the side of patients, particularly disadvantaged communities, people in poverty, people with special needs, and finally, be a leader. In whatever you do, there's always a leadership aspect. So this 3-point plan, I believe, can help us get to this special place of optimistic medicine, because lots of small changes leads to big outcomes. Thank you.
Thank you, Professor Lakhani, for that really inspiring talk. The talks today, the panel discussion and workshops have been incredibly informative and inspiring. I wanted to bring you all back to what I said right at the start of the conference, that the FDocs team at Medics Academy is incredibly passionate about making professional development meaningful to the individual. So I wanted to take you through just some of the opportunities we have available for you to get involved with. It's often difficult to really know what's available for you and what to get involved with during foundation, as well as how to develop your career the way you want to. At Medics Academy, we don't just think about you having started your medical career. We're more interested in supporting people with enthusiasm, determination, and drive. So today I'm going to tell you about lots of different opportunities that are available to you. And let's start with FDocs. FDocs is a program of support for foundation doctors going through the foundation program and was created by a team led by Professor Derek Gallen, former National Director of the UK Foundation Programme and President of ASME. And we are currently being commissioned to run FDocs for the foundation trainees in the Northern and Yorkshire and Humber foundation schools. Most of you will be familiar with what FDocs has provided for free since the start of the pandemic. We deliver regular webinars, e-mentorship sessions, virtual sims, conferences, give you access to a resource bank, as well as a community of foundation trainees from across the UK. We're also the team that delivered the world's first ever live worldwide virtual sim, as we wanted to try to solve the problem of sim sessions being cancelled for all foundation trainees at the peak of the pandemic. Have a look at how we used our technology to deliver sim to 106 people in one go. Now, FDocs Plus is what we are commissioned for by Health Education England North East and Yorkshire and Humber, and it offers a lot more with regards to professional development with virtual study days in MedEd, QI and leadership, as well as e-learning modules and much, much more that can be evidenced on your Horus e-portfolio. We've also had a lot of individual foundation trainees purchase this FDocs Plus license from us, and it can also be claimed on your study budget. We then have the Scholars Programme, which is a competitive programme where we work closely with each individual scholar to support them with achieving their dreams and goals. We have a network of over 150 clinicians and work with industry specialists, so we can really empower individuals through this programme. And it's not only 1 year we support you as your career progresses. Applications are currently closed for this year, but do register to be contacted when our next application period opens. This is the programme, the Scholars Programme, that is open to final years. And this is just an infographic of what we deliver as a baseline. This is what we deliver to F1s, F2s, F3s and beyond. Now, if you're someone who's interested in Medics Academy and actually how we work and what we do on a daily basis, then perhaps the Medics Academy Fellowship Programme is for you. The Medics Academy Fellowship Programme is an 18-month programme taken alongside work or studies, and it's a real opportunity to get to know Medics Academy, the team, and what we do on a day-to-day. As a fellow, you are very much part of our team and get to know everyone and contribute to medical education, technology, and management. And also, you get to work on actual content creation, program development, and shape the future of what we do. This is what the program looks like, and you're expected to spend on average between 3 to 6 hours per week as a fellow. Our next round of applications opens in January. So before then, have a listen to what other scholars thought.
Hi, I'm Dina Alsawi, a final year medical student. I've been a fellow at Medics Academy for a year, and the reason I joined is because I have a keen interest in medical education. Medics Academy gave me the opportunity to work with talented individuals such as expert clinicians, designers and programmers.
Medics Academy is a technology startup company producing next-generation medical education in the global marketplace. We are enabling healthcare professionals to learn in new and innovative ways. The Medics Academy Fellowship Program is an opportunity for medical students to utilize their theoretical knowledge in real projects. Student fellows gain experience by working with senior medical practitioners on life projects where they are mentored.
The Medics Academy is an incredible mix of artists, filmmakers, doctors, engineers.
I started my fellowship as an author for the ENT course, and in order to develop the course and my leadership skills, I recruited my own team. The fellowship program has allowed me to develop a wide range of skills such as teamwork, leadership and project management.
If you have a startup or project of your own, you will be fully involved from the front line from the outset.
We are currently recruiting passionate and hardworking medical students to join our offices in central London. The fellowship aims to foster key skills that will prove useful throughout your medical career. We also aim to provide regular workshops at the head office to develop a variety of skills from leadership and management to product development. Our students have gone on to present work undertaken at national and international conferences, have had work published academically, and have gained access to our incredible network of collaborators. They also continue to work with us subsequently and have gone on to lead long-term teams and projects with Medics Academy.
Applications are now open, so join us now by applying on medics.academy/opportunities.
The Management Fellowship will be an opportunity to gain key skills managing a programme and a team to achieve key goals. If you are interested in developing these skills in particular, make sure you apply. Now moving on to postgraduate courses, because Medics Academy delivers education at all different levels. So the team at Medics Academy has teamed up with the School of Medicine at the University of Central Lancashire to offer an accredited master's level programme. This programme leads to postgraduate qualifications in a PG Cert, so a PG Cert in clinical practice, management and education. And for the PG Cert, the modules will include technology enhanced learning, clinical leadership and applied clinical education, which can also be undertaken part-time. Register now to stay up to date with when the next application period opens in January. Did you know the Medics Academy team is the team also behind the HLA? You may have heard about the HLA from the Healthcare Leadership Academy Scholars Programme, which is an incredible programme for future leaders in healthcare, and it's what the HLA is most well known for across the globe. However, you can also get involved in the HLA through the leadership blog, HLA Listen, all the events, including HLA Live, HLA Welfare, networks, HLA Ideas, and the future. So what's coming next for HLA, which is thinking about HLA Think and the international expansion. You can also sign up for the HLA Associate membership, and it's currently 75% off for students. All you need to do is email in with your student ID number. Do you think the HLA might be for you? Have a listen to what other scholars think about it.
Throughout our medical training, we always know what the next step's going to be. We go to medical school, we go through foundation training, and then the expectation is to choose your specialty and progress. But this is difficult if you're not sure what you want to do. It's difficult if you have lots of energy and you don't know where to put that energy. And it can be intimidating if you can hear lots of loud voices around you, talking confidently about what they want. During my time with the HLA, I've been able to formalise my ideas and find out where I want to put that energy. It's enabled me to overcome my imposter syndrome, which I think we all share. And I've finally found my course and what I want to dedicate my energy toward.
So applications are currently closed, but they will open for the next intake. Keep an eye on the HLA website for when that is. And if you're interested in gaining qualifications in leadership and post-nominals from the Institute of Leadership and Management in particular, have a look at the HLA ILM5. It's a fully virtual program, and it does what we really champion at Medics Academy. It provides flexible learning, which means it can be completed at your own time, at your own pace. And it's designed for those of you interested in leadership and interested in gaining some post-nominals and membership of the Institute of Leadership and Management. It's a really great program, so I do encourage you to have a look. And for those of you who are interested in medical education, we also run a training and teaching course at Medics Academy, which helps develop clinicians interested in medical education. You can opt for the 1, 2, or 3-day course and also gain points for your specialty applications at the same time. Here's some of the feedback we've received on the course.
Hi, so my name's Zaid. I am an F1 in West London, and I just completed the Medics Academy training in teaching day 3 course.
I think it's structured in a really nice way with a lot of resources. You can permanently access. The course isn't over after 3 days. You've got a ton of online content that you can always revisit, and I think that is fantastic.
I thought it was a great way to learn through having a full day at the start and then 2 later days of self-study. It really allowed for flexibility and allowed us to fully engage in the course.
It also made me feel better prepared to deliver teaching remotely or digitally.
It's really interactive. There's a lot of small group feedback session, exchanging ideas and learning people's perspective.
After actually doing this course, I realised that teaching is more of a science, and it's really important to get clear feedback so that you can improve your teaching.
This course also encouraged me to think thoroughly about what my audience actually wants from my teaching session, and also how I can keep them better engaged.
Really great, fantastic to get such fantastic lectures from experts in the field throughout the 3 days. It was also interesting to learn from others taking part in the course because we all have different levels of experience, so it was interesting to gain their perspective.
I learned not just about a different style of teaching, I also learned about what is medical education, how to build a career in medical education.
overall, I learned a lot from it.
I think it's a really well done course.
I really enjoyed it.
Very enjoyable.
That's what I thought of the whole course, and I really enjoyed it, and I'd recommend it to other people.
So thank you for letting me participate.
Our courses are normally fully booked, so do check out our October and November courses using these QR codes now. And many of the doctors who have completed the training and teaching course go on to teach on our other programmes. One example of this is the Medics Academy Virtual Elective, which is a 4-week programme in technology enhanced learning and medical education. We've got lots of electives in development, so please do let us know if you're interested in getting involved. We love to work with enthusiastic, self-motivated and innovative people. So if you do want to see what we're about, get involved, or if you know what type of programme or project you want to get involved with, or even if you don't know, drop us an email at f-docs@medics.academy. And that's it. We've had a day packed full of fantastic speakers, including Dr. Claire Van Hamel, taking us through really interesting data on the foundation programme and the evidence base behind the programme we know today. Dr. Sarah Hallett, equipping you with the foundation toolkit you need to be more confident with rota, pay, leave and more. Dr. Henrietta Hughes, introducing many of us to the important work that the National Guardian's Office is conducting. And Professor Lakhani's further inspiring us in our careers with his stimulating talk. The panel discussion was incredibly interesting. At the start of our medical careers, it's often easy to stop taking care of ourselves whilst focusing on taking care of our patients. But that's definitely not the way to stay healthy during foundation. And we had a lot of great advice about maintaining that balance that we need to thrive. The virtual workshops were incredibly stimulating and varied, as we wanted there to be something for everyone to try to make professional development meaningful to you, the individual. So if you like what we do, join our FDocs Facebook group or tweet #FDocs to show your support. And if you're interested in FDocs, the HLA, the fellowship programme or postgraduate courses or anything else we do not hesitate to get in touch at f-docs@medics.academy. Thank you for joining us today. Have a lovely rest of the weekend.